Take a look at your tongue right now. Is it white, swollen, cracked? Your tongue can actually reveal shocking secrets about your health. From vitamin deficiencies to serious infections, today we're uncovering the truth your tongue is trying to tell you. We'll explore the different ways your tongue reflects what's going on inside your body, because early detection is key to staying healthy. Let's start with color. A healthy tongue should be pink and moist, kind of like a fresh piece of bubblegum. But if it looks different, here's what it could mean. First up, we have a white coating. This is probably the most common thing people see, and it's often a sign of poor oral hygiene. Basically, it means you need to brush your teeth better and maybe floss a little more often. But a white coating can also be caused by a yeast infection, like oral thrush or even dehydration. So if it doesn't go away with better brushing, it's time to see your doctor or dentist. Now, if your tongue is bright red, it could indicate a vitamin B deficiency. This is important because B vitamins are crucial for energy production and cell function. A bright red tongue can also be a sign of scarlet fever, a bacterial infection, so definitely get that checked out. Next, we have purple or blue. This one's a little scarier because it might signal poor circulation or even heart problems. Now, I don't want to alarm anyone, but anytime you see blue or purple discoloration, especially in your tongue or lips, you need to get it checked out by a doctor as soon as possible. Moving on to yellow. This could be due to a buildup of bacteria, kinda like with the white coating, but it can also be a sign of acid reflux. That's when stomach acid flows back up into your esophagus, and it can irritate your tongue. And lastly, if your tongue is pale, it could be a sign of anemia or low iron levels. Iron is essential for carrying oxygen throughout your body, so if you're not getting enough, you might feel tired and weak. Remember, color matters, and it might be warning you about more than just your breath. Next up, texture and bumps. Your tongue isn't supposed to be perfectly smooth. It's covered in tiny bumps called papillae, which contain your taste buds. But changes in the texture and bumps on your tongue can also be signs of underlying health issues. First, let's talk about a smooth tongue. While some smoothness is normal, a tongue that's completely smooth, like it's been ironed flat, can indicate a lack of nutrients. This is often linked to deficiencies in iron, folate, or vitamin B12, all of which are essential for cell growth and development. Now, if you see cracks or fissures on your tongue, don't panic just yet. Some people naturally have deeper grooves on their tongue, and that's perfectly fine. But deep cracks can harbor bacteria and food particles, leading to bad breath and even infections. So if you have deep fissures, it's important to clean your tongue gently with a tongue scraper or toothbrush to remove any debris. Enlarged papillae, those little bumps I mentioned earlier, can also be a sign of something else going on. They often become inflamed and enlarged due to irritation from smoking, spicy food, or even stress. And then we have the hairy tongue. Now, before you freak out, hairy tongue doesn't mean you're actually growing hair on your tongue. It happens when dead cells build up on the surface of your tongue, creating a rough, hairy appearance. This can trap bacteria and yeast, leading to bad breath and a change in taste sensation. Remember, these aren't just cosmetic concerns. They could be early health warnings. Chapter 3. Pain, Swelling, and Sores. Now let's talk about the not-so-fun stuff. Pain, swelling, and sores. If you experience any of these, it's important not to ignore them. A sore or swollen tongue could mean more than just biting it accidentally, especially if it lasts for more than a few days. Painful sores on your tongue could be canker sores, which are usually harmless and go away on their own within a week or two. However, they can also be a sign of something more serious like herpes or even early signs of oral cancer. So if you have a sore that doesn't heal within 2 weeks, or if it's accompanied by other symptoms like fever or swollen lymph nodes, see your doctor or dentist right away. Swelling of the tongue can be a sign of several things, including allergies, infections, or even reactions to medications. If your tongue suddenly swells up, it could be a sign of a severe allergic reaction called anaphylaxis, which requires immediate medical attention. And then we have the burning sensation, also known as burning tongue syndrome. This condition causes a burning, tingling, or numb sensation on your tongue, and it can be incredibly uncomfortable. While the exact cause is unknown, it's often linked to menopause, stress, or nutritional deficiencies. The bottom line is, never ignore pain that lasts more than 10 days. Chapter 4. When to see a doctor. Your tongue is like a window into your overall health. It's one of the most important sensory organs, playing a vital role in tasting, chewing, swallowing, and even speaking. But beyond these everyday functions, your tongue can also provide valuable clues about what's happening inside your body. So when should you see a doctor about your tongue? While some changes, like a temporary white coating or a mild burning sensation, might not be cause for concern, others can signal underlying health issues that require medical attention. If you notice any of the following, it's essential to consult with a healthcare professional. Persistent discoloration, pain, swelling, or unusual growths on your tongue. These changes could indicate infections, nutritional deficiencies, autoimmune diseases, or even oral cancer. Don't wait until the symptoms worsen or become unbearable. Early detection and treatment are crucial for preventing complications and ensuring the best possible outcome. Your tongue is one of the easiest places to spot internal imbalances early. Outrow. Listen to your tongue. Now that you know what your tongue is telling you, do a quick check. Like this video if you found it helpful. And hit subscribe for more simple health tips. Your body is always talking. Are you listening?